apply nursing practice in the primary healthcare setting. Determinants of health. Determinants of health are many factors combined together to affect the health of individuals and communities. Whether people are healthy or not is determined by their circumstances and environment. To a large extent, factors such as where we live, the state of our environment, genetics, our income and educational level, and our relationships with friends and family all have considerable impact on health, whereas the more commonly considered factors such as access and use of healthcare services often have less of an impact. The determinants of health include the social and economic environment, the physical environment, and the person's individual characteristics and behaviours. The context of people's lives determine their health. Individuals are unlikely to be able to directly control many of the determinants of health. These determinants, or things that make people healthy or not, include the above factors and many others. Income and social status. Higher income and social status are linked to better health. The greater the gap between the richest and poorest people, the greater the differences in health. Education. Low education levels are linked with poor health, more stress, and lower self-confidence. The physical environment, safe water, clean air, healthy workplaces, safe houses, communities, and roads all contribute to good health. Employment and working conditions. People in employment are healthier, particularly those who have more control over their working conditions. Social support networks. Greater support from families, friends and communities is linked to better health. Culture, customs and traditions and the beliefs of the family and community all affect health. Genetics. Inheritance plays a part in determining lifespan, healthiness and the likelihood of developing certain illnesses. Personal behaviour and coping skills, balanced eating, keeping active, smoking, drinking and how we deal with life stresses and challenges all affect health. Health services. Access and use of services that prevent and treat disease influences health. Gender. Men and women suffer from different types of diseases at different ages. Our health is influenced by far more than the healthcare system or the individual choices we make. People in the most disadvantaged social groups are far more likely than those in higher socioeconomic groups to have long-term physical or mental health problems. This may affect their ability to complete an education or keep working to retirement. They are also more likely to die at a younger age, and importantly there is a gradient of disadvantage from the lowest to the highest socioeconomic status, reflected in a gradient of health problems. Thus, targeting the most disadvantaged is only part of the solution. Addressing the root causes of the gradient is crucial. Environmental determinants of health. In watching diseases both in private homes and in public hospitals, the thing which strikes the experienced observer most forcefully is this: that the symptoms of the sufferings generally considered to be inevitable and incident to the disease are very often not symptoms of the disease at all, but of something quite different. Of the want of fresh air or of light or of warmth or of quiet or of cleanliness or of punctuality and care in the administration of diet, of each or all of these. Florence Nightingale, 1860. Environmental factors that affect health are commonly overlooked in routine patient assessments. The ANA, American Nurses Association, provides an explanation of 3 basic nursing activities that specifically states issues are related to environment and health, a preventative approach to health, and concern for populations as well as individuals. The first is restorative practices modify the impact of the illness and disease. Supportive practices that are aimed at modifying relationships or the environment to support health. And thirdly, promote practices which initiate wellness patterns of living and foster personal and familial development and support self-defined goals of individuals, families and communities. Environmental health components of history taking can be integrated into the routine assessment of patients by including questions about prior exposure to chemical, physical or biological hazards and about temporal relationships between the onset of symptoms and activities performed before or during the occurrence of symptoms. Nurses need to extend the concept of advocacy to include activities on behalf of communities and other groups and in settings such as the workplace or community meetings. This extension of nursing advocacy is often essential for addressing environmentally related health issues because they are frequently intertwined with social and political factors. Nurses may act as investigators by being alert to environmental factors that influence health, working with interdisciplinary teams and with agencies to determine if an environmental exposure is affecting the health of a community, initiating or engaging in research to identify and control environmental exposures that adversely affect human health, and working with public and private institutions to perform risk and hazard assessments. Thank you.